Before you are taken to the operating room, your anesthesiologist will talk with you about the medications used during the procedure, and he will administer the medications once you are in the operating room. Next, the surgeon will make an incision in your leg to access the hip joint. Your surgeon will select the appropriate incision length and approach that is best for your case. After the incision is made and exposure is adequate, the ligaments and muscles are separated to allow access to the bones of the hip joint. The femoral head is then dislocated from the hip joint and removed at the level of the femoral neck. After the femoral head is removed, the cartilage of the acetabulum is removed using a special reamer that forms a hemispherical shape. The remaining void will allow for a proper fit of the metal shell. A provisional or trial component is placed in the reamed area to determine the proper size and fit. Once your surgeon is satisfied with the size and positioning of the trials, he will implant the metal shell. The next step involves preparing the femoral canal to accept the femoral stem implant. Special instruments are used to hollow out the femur to match the shape of the metal stem of the femoral component. Trial components of the femoral stem, femoral head, and acetabular shell are temporarily implanted to ensure the proper size and fit of the final implants. At this stage, the surgeon will move your hip in all directions to make sure the trial components are implanted appropriately to achieve adequate range of motion. Once he is satisfied with the placement of the implant trials, he will insert the final components. For some patients, a special type of acrylic cement, which is well tolerated by the body, is used to fix the components to the underlying bone. For other patients, the implants are fixed to the bones without cement. In these cases, the implants are coated with a special porous surface that allows the living bone tissue to adhere to the implant. Finally, the incision is closed, an external dressing is applied to the incision, and you will be taken to the recovery room. In the recovery room, the staff will monitor your vital signs until you are transferred to your hospital room.